first thing I would like to say is how privileged and how happy I am to have been able to get my orthopedic training at the Campbell Clinic in Memphis, Tennessee. I felt like the most privileged person on earth in 1962 when I was accepted here, basically on the spur of the moment. And I'm so delighted to have had the experience of being trained under whom I consider the greatest orthopedic surgeon in the world, Dr. Harold Boyd, Dr. Hugh Smith, Al Ingram, Marcus Stewart, and on down the line. Secondly, I'm so delighted and elated that the Campbell Clinic chose to accept my son, Dr. Bill Hunt, for his training. And as a coincidence, the year he finished his training, 1988, I was president of the Campbell Club, as he is now. And that is a unique experience for each of us. I, of course, have been retired for 17 years from the active practice. But the experience that I got here at the clinic, the motivation I got, the understanding I got, the dedication that I saw, led me not only to try to be the best orthopedic surgeon in the world myself, and in using the principles that I had learned and learning new techniques, but also in being innovative and developing new techniques.
The Campbell Clinic teaches you a healthy, conservative approach to orthopedics. And that healthy, conservative approach, for the most part, has resulted in a lot of happy patients and, fortunately, few complications. And I think that's what our training is all about.
Yes, conservatism first, and that conservatism gives you the foundation to make a springboard for being a little more aggressive. You say, well, I know this works. I know this is perfect, but or maybe not perfect, but it's good. And then that gives you an opportunity to say, well, it gives you the freedom to start expanding your thought process and looking for something better. I might note that at the time I finished my training in 1965, when we would have these Campbell Club meetings, and if you look at this little book, you can see the list of presidents is fairly short at that point in time. Almost everyone who came back to the meeting had a professorship position somewhere. I wasn't the first by far, but I was one of the few who were out in the, so to speak, beating the bushes in the rural area, bringing orthopedics out to the world rather than the world having to come all the way to the Campbell Clinic in like centers around the country. But I can honestly tell you, when I left the Campbell Clinic, I had no fear of anything. I had been exposed, I think, to everything that the world had to offer in the world of orthopedics. Now that was a little bit arrogant, I guess, to think so, but I felt 100% trained in hand surgery and every aspect of surgery. My advice is this: you must, first and foremost, always be willing to serve. In my opinion, a physician who is not, from the bottom of his heart, put his patient first really shouldn't be a physician. That's the very first thing. The patient is the absolute most important thing. First of all, we have to be trained adequately to know what we're doing, and we have to stay trained. The day you walk out of your training program, you just have a foundation. Continuing education is something that's got to be done on, probably every 3 to 4 months period the rest of your life, because innovations are happening so fast you can't keep up. So those are the things. Be compassionate, be attentive, be educated, and put the patient first always.
leaders who are here now at the Campbell Clinic. Some of them were here when I was here, but Dr. Azar and still Dr. Beatty, Dr. Canale, they've been giants in their field. But they're all very grounded people, and I think you get that grounding here, and I think grounded people make good leaders. I would say to anybody and everybody who thinks they might want to do orthopedics that you would be privileged, as we were, if you were invited to participate in this program.
I'm still delighted and grateful to be able to come and participate and see how the world of medicine is changing, but how some fundamental facts never change, and that's the Campbell Clinic. The fundamentals never change, and that delights me.